it is beyond a shadow of a doubt that many lives could have been saved and quality of life for many people could have been improved if government had just followed through on the actions that they had planned to do. Hi, I'm Howard Spencer of Spencer's Whole Food Plant-Based Eats and Treats, where we believe that the path to good health is by changing your environment, especially your food environment, for the better. In this video, I will... Wait, what was that?
Trinidad and Tobago will head to the polls on Monday, April 28th. A media release from the office of the Prime Minister indicates Prime Minister Stuart Young has advised President Christine Kangaloo to dissolve Parliament with effect from midnight on Tuesday, 18th March, in accordance with Section 68 of the Constitution. The Prime Minister has also advised the President that in accordance with Section 33 of the Representation of the People Act, Chapter 201, writs of election for the 2025 general elections are to be issued on the 18th of March 2025. Friday, 4th April has been fixed as nomination day and Monday, 20th April as polling day.
Oh, sorry about that. That's just the sound of the election bell ringing. But wait, hold on. This is a health and nutrition channel. Why are you so concerned about elections? What does this have to do with health and nutrition? Well, you mightn't believe me when I say this, but who you vote for affects your health. Seriously? Yes, seriously. Despite what certain people might think, the actions and policy measures of your elected government representatives have a direct impact on your health, your family's health, your community's health, and the health of the entire nation. And in this video series here, I will bring to the forefront certain actions and omissions of this incumbent government that will have directly impacted your health and the health of the entire nation. The nation of Trinidad and Tobago, that is. As is well known, chronic disease or non-communicable diseases are a major threat facing the nation of Trinidad and Tobago.
Non-communicable diseases, mainly heart disease, diabetes, cerebrovascular disease, and cancer are globally and locally the leading causes of morbidity and mortality. Cardiovascular disease is the leading cause of mortality, accounting for more than 70% annually.
Recent data has indicated 14.8% of the country's adult population is living with diabetes. And diabetes continues to generate a substantial burden on overall disease in the population. The increase of this non-communicable disease has placed an added strain on the country's healthcare system. Cardiovascular disease is the #1 cause of death in Trinidad and Tobago. PAHO says TNT is one of the countries in the region with the most cases of arterial hypertension.
I don't see how the expenditure allocated to those items, and there are others like NCDs, we are among the top 3 in cancer, cardiovascular diseases, hypertension, diabetes.
The premise of the question from my colleague from Naparima, as usual, is inaccurate, since our demographic profile is entirely different to the rest of CARICOM, and we have one of the highest rates of NCDs in CARICOM, incidentally.
Madam Speaker, NCDs is one of the most critical elements facing this country. And our health budget went up from $3.08 billion in 2008 to $6.0 billion in 2019. That is unsustainable. We have to tackle NCDs. Trinidad and Tobago has spent $40 billion in healthcare from 2005 to 2016. But are we healthier? The answer is no.
Even so, what has been their general attitude towards this crisis?
One of the major success factors is going to be for the population, and I mentioned this, to undertake self-management and recognize that they also have a role to play.
Given the findings that are linked between alcohol consumption and non-communicable diseases, is the ministry considering restrictions on advertising sale of alcohol beverages?
Restricting the advertising of alcohol is not something that the Ministry of Health is considering right now as a policy position. What we have always advised people to do is to make the wise choices.
Are there any plans as it relates to front of package labels, taxation on unhealthy foods, restriction on advertising, etc.? Because I think some years ago, you would have met with fast food chains, yes, fast food chains, and you actually condemned them on the way they were advertising at the World Health Assembly, and nothing has really changed. Not much has have changed. So, are there any type of legislative plan as it relates to unhealthy foods?
Yes, so I think I also made the point that people have to make wise choices. We live in an open market society, so we always advise the population, a lot of the onus is on you, and especially parents, not to overindulge in fast foods. Do everything in moderation.
I get the issue of the population, but in terms of the fast food chains, you know, they were supposed to, based on your conversations, they were supposed to put healthier options on their menus. What has become of that?
They had pledged to introduce it, and I think they have.
You think they have, or you
Yes.
can confirm?
It's voluntary. It's voluntary. I can't compel them, but we have to ask parents again to guide their children in making wise food decisions.
But Minister, we are not speaking ban, but legislation can somehow regulate. So that's why I'm asking about legislation, not specifically banning anything.
What legislative measures would you recommend?
It will depend on your findings.
Yeah.
So that's why we're asking the question from the committee's end. If you have any planned legislation, just like vaping, in terms of packaging and unhealthy foods.
No, at this point in time, and I made that point clear when I spoke at the assembly, we have no plans to legislate what people eat. We ask people to make the wise decisions, and Dr. Clapperton could tell you we have done a lot of work in how to read labels. What is the salt content in French fries? 16 teaspoons of sugar in one soft drink, when your average daily intake should be, what, 6? Or thereabouts?
I understand your position of not wanting to ban, but other jurisdictions have found success because moral suasion doesn't always work, and sometimes it's availability, and a lot of it is marketing, and a lot of it means that while we try moral suasion, the NCD epidemic continues, putting a burden not only on the healthcare system, but on the human resource capacity of the population. And I guess that's why Member Mohit's advocacy comes into maybe try both at the same time. Moral suasion will work and personal choices should work, but also sometimes you have to legislate not for the consumption part, but from the supply part.
So it is not the ministry's position at this time to recommend that sort of harsh measure.
Thank you.
So in other words, the chronic disease crisis that this nation is facing is the fault of the people of the nation? Is that what you're saying, Mr. Minister? The general posture of this government seems to be that they have done their part in providing the necessary information and support required for us, the population, to make better decisions and facilitate behavior change through campaigns like TT Moves and other initiatives of the sort. But is that enough? I say absolutely not. As I have mentioned in previous videos, the fact that we have a population in which over 300,000 people is challenged with hypertension and over 200,000 people are challenged with diabetes. This is not a personal responsibility problem. This is an environmental problem, specifically a food environment problem, because the numbers are too high for it to be just a matter of personal responsibility and behavior change. Let's start with hypertension. One of the biggest chronic diseases facing our nation. Here is Paul Richards, Chairman of the Joint Select Committee of Social Services and Public Administration, outlining some statistics regarding the state of hypertension in Trinidad and Tobago.
PAHO says that Trinidad and Tobago is one of the countries in the region with the most cases of arterial hypertension. It reported the Caribbean has the highest rates of hypertension, accounting for a quarter of the population. But Trinidad and Tobago has an even higher hypertension number than the overall region. It reported that while the Caribbean has a 23% of rate of hypertension compared to 17.6%, that's just over 6% difference, while TNT has a 25.8% overall rating, 29% in men and 23.7% in women.
Just one thing, Dr. Richards. I think those statistics are a little outdated. I think Dr. Maria Clapperton has some more updated statistics for us. Dr. Clapperton?
With respect to raised blood pressure, there was a prevalence of 29.0% of persons with having a raised blood pressure.
And as you can see here, the prevalence of hypertension in men was 33.2%, and in females it was 24.9%. So you can see there was an increase in both the men and the women and overall. So therefore, hypertension rates have increased since 2012, and I'm not surprised. Dr. Abdul Hamid of the North Central Regional Health Authority, he also highlighted some troubling hypertension trends in the population in a recent town hall meeting.
Even when we have large-scale public screening activities, that goes up to approximately 50%. And of those 300,000 persons, only half of those persons know that they have high blood pressure and are being treated or are taking treatments or are doing something proactive with. So we have walking around everywhere. We have tens of thousands of people who don't know their status. And that is something that we as a nation, we need to fix.
So what did the incumbent government do to specifically address hypertension?
The introduction and 100% scale-up of the Hearts Initiative. This is a program that focuses on reducing the burden of cardiovascular diseases through effective management of hypertension and high blood pressure across all health centers, with over 66,000 persons being enrolled and 28,237, or 43% of them, having achieved control of their hypertension to date. Another first for Trinidad and Tobago.
Now, I did talk about the Hearts program in this video here. And in that video, I alluded to what I thought the Hearts program was. The Hearts program, I thought, was a program centered around medication and pharmacological interventions. But after taking a deeper look, I realized that it's a lot more than that. The Hearts program takes a look at non-pharmacological interventions. So therefore, they look at addressing lifestyle changes first before medication comes into play if the lifestyle interventions cannot address the hypertension fully. So I will give credit where credit is due. The Hearts program is a lot more balanced than I initially thought. Having said that, here is the problem which I have with the Hearts program in its present form. Even though the Hearts program was launched in Trinidad and Tobago in 2019, and it has expanded to over 100 centers around the country, hypertension rates still increased from 26% in 2012 to 29% in 2024. So that means the Hearts program alone is not doing the job. Think of hypertension like this. You have an overflowing sink with the tap running water at full throttle. What do you think that needs to be done in order to remedy that situation? You turn off the tap. It makes no sense getting a mop and a bucket and cleaning up the mess off the floor if there is more water coming from where it came from, the overflowing sink with the tap running at full throttle. But yet, this is exactly what you're doing with the Hearts program. Mopping up the floor, but there's more where that came from. So how do we really turn off the tap in this instance? Okay, well, this should give you the clue. What is the most primary pieces of advice that a doctor gives you if you go into a doctor's office, the doctor checks your blood pressure and it's high? What is the primary piece of advice that most doctors and most medical professionals tell you that you should do? Cut down on your salt intake. Now, this incumbent government, as in many other things, have treated salt consumption as a personal responsibility matter. Now, what has been the main strategy of this government to support the population in reducing its sodium consumption? It has mainly been educational materials on reading food labels and general tips and strategies to reduce salt consumption. But here's the hurdle that Trinidad and Tobago has, and it's a major hurdle. Trinidad and Tobago's food environment is one in which sodium is ubiquitous. Processed foods, restaurant foods, and even some local dishes contribute significantly to sodium intake in the population. In this tin of corned beef here, you see that one serving is just 1 ounce. And there are 12 servings in this tin of corned beef. So 302 by 12, that's just over 3,600 milligrams of sodium in just this tin of corned beef. Oh, and by the way, let me just give you this little friendly reminder that the World Health Organization's sodium limit per day is 2,000 milligrams. And the American Heart Association is 1,500 milligrams for the day. So if you eat out one tin of that corned beef, you doubling the American Heart Association limit in just one tin of corned beef. Even in cereals too. Oh, you thought you was getting away from the sodium when you eat cereals. Well, take a look at this. 1 cup of cornflakes gives you 218 milligrams of sodium. So 2 cups of this over 400 milligrams of sodium. Sorry, you're not getting away from it. And if you look at the cereals that are available in the parlor shops and the supermarkets, you will find that quite a bit of the cereals that are available have quite a bit of sodium in them. Oh yeah, and one of these takes you over your sodium intake limit for the day. Even 2 slices of Kiss-enriched white bread takes you to about 20% of your daily recommended sodium intake. Therefore, in a food environment like Trinidad and Tobago, it is not realistic for people to watch their sodium intake and stay under 1,500 milligrams a day or even 2,000 milligrams a day and control their hypertension effectively. Simply put, most of the foods in Trinidad and Tobago are loaded with too much salt. So this is why I said that I was not surprised when I saw the statistics reveal that there was an increase in hypertension prevalence in Trinidad and Tobago from 2012 to 2024, because every day in Trinidad and Tobago, an average Trinidad and Tobago citizen has to make multiple food choices in a food environment where salt and sodium is all around the food environment. And what is the solution? Well, that is where the government is supposed to come into play. And why do I say that? To say why, I want to borrow a quote from this scientific paper, Sodium Intake and Hypertension. The experience from Finland and Great Britain suggests that no comprehensive salt reduction may be possible without effective governmental interventions. And I want to discuss the Finland story a little bit, because Finland has been one of the most fascinating stories of improvement of cardiovascular health on a population level. In the 1970s, Finland had one of the highest rates of cardiovascular disease in the world. The epicenter of this chronic cardiovascular disease epidemic was in a province by the name of North Karelia. This high rate of cardiovascular disease was due to excessive salt and excessive fat intake. So what did the Finnish authorities do to turn this situation around? They partnered with the food industry to lower sodium content of processed food. They ran nationwide media public health campaigns about the benefits of salt reduction. Then later on, the Finnish government, they introduced a legislation to have high salt warning labels on certain food products, such as breads, sausages, cheeses, and breakfast cereals. And what were the results of these initiatives? As you can see here, there was an over 30% decrease in salt intake in the population, from 14 grams to around 8.4 grams. And as you can see, because of the decrease in salt intake, there was a corresponding decrease in blood pressure in both men and women. Now, on this graph here, they have the diastolic blood pressure, but there was a corresponding decrease in systolic blood pressure as well, roughly around the same drop. And with this corresponding drop in salt intake and blood pressure, there was a corresponding drop in mortality due to cardiovascular disease. As you can see here in this graph here, there was a drop-off in coronary heart disease mortality, especially in the men, but there was also a drop in mortality in the women. And then also there was a large drop-off in deaths due to stroke because of this drop in salt intake and corresponding drop in blood pressure. And with that drop due to mortality due to stroke and coronary heart disease, there was an increase in life expectancy in both the women and the men in Finland. Now, how were the Finnish authorities able to achieve these fantastic results?
I always say you can't manage what you can't measure.
Exactly. These solutions worked because the Finnish authorities had the data to drive these decisions. The Finnish authorities, they conducted sodium intake surveys using 24-hour urinary sodium excretion as the way of measuring sodium intake in the sample population in their surveys. Gosh, if only the Trinidad and Tobago government had the wherewithal to think about something like that. Wait, what? What? They did? No, I can't be hearing right. They had that in mind and they didn't follow it up? Apparently in 2017, the Incumbent government had a plan to capture data of sodium intake in the population. Now, for those of you who don't know what I was talking about, this was the plan they had in mind. The National Strategic Plan for the Prevention and Control of Non-Communicable Diseases, 2017 to 2021. Mind the years. We are in 2025 now, right? So, just keep that in mind. So, take a look at this. This was supposed to be one of the action items that was supposed to be done from this National Strategic Plan. Read that. 1.3.2. Establish baseline for population sodium and trans fat intake. Now, how are you going to do that? You do that by conducting studies. Oh, and when you take a look at that, they were supposed to conduct a salt study to determine the level of sodium intake in the population. Oh, and as a side note, they were supposed to do this for trans fat too. And by the way, Trinidad and Tobago was one of the signatories who had declared or who had pledged to remove trans fats, industrially produced trans fats, from the food supply by December of this year.
In 2022, a decision was taken by CARICOM member states to eliminate industrially produced trans fatty acids from the regional food supply by the 31st of December 2025. Presently, no CARICOM country has national TFA legislation.
I wonder how that is going to be done. But as you can see, these studies to determine sodium and trans fat intake, the government never did them. But these are the words of the present Minister of Health.
I always say you can't manage what you can't measure.
So, Mr. Minister, why hasn't your government measured these two important dietary factors, especially given the prevalence of hypertension in the population? However, a Caribbean country which has taken substantial action to reduce the population sodium intake due to its high prevalence of hypertension in the country is Barbados. Unlike Trinidad and Tobago, Barbados actually conducted a SALT study between the years 2012 and 2013. The data acquired from that study, they used it to run media campaigns on salt reduction. They taxed certain salty snacks by 20%.
Sir, we will, however, with effect from June 1st, 2025, place an excise tax on certain snacks with high salt content, such as Pringles, Lay's, sir, salted nuts, corn kernels, sir, hot balls, sir, cheesies, salted popcorn, sir, tortilla chips, salted pretzels, and salted crackers, sir.
And then they removed VAT and import duties from specific foods.
In addition to the above items, sir, we will remove the import duties and VAT, sir, on pears, not avocado, sir, pears, hortaniques, mandarins, grapefruits, and plums, sir.
So why is Barbados ahead of us in terms of implementation of these policies to help improve the population's health? It's simple. They just got the data and used the data to take action. Maybe the government that is coming in after April the 28th could learn something or two from Barbados. So hypertension is still one of the main chronic diseases that is plaguing the Trinidad and Tobago population. And oh, by the way, heart disease is still the #1 killer in Trinidad and Tobago, and stroke might be either #2 or #3, depending on the situation of the data now. And yet, the incumbent government ignored its own plan to tackle hypertension effectively. To me, it is beyond a shadow of a doubt that many lives could have been saved and quality of life for many people could have been improved if government had just followed through on the actions that they had planned to do. So now that the election bell has rung and we are in election season, Trinidad and Tobago, this is what you have to do if you want to get a government or get government representatives that work for your own best interest, especially in the area of health. Ask tough questions of all your prospective candidates, the incumbent ones and the ones who are looking to take the incumbent government's place. Ask them questions like, what are your plans to improve the health of the population? Actions which just go beyond providing health care and actually working on improving the health of the population by improving the food environment. Feel free to ask the incumbent government tough questions such as, you had a plan that would have been more effective in addressing the hypertension epidemic in the country. You had a plan. Why didn't you act on it? Remember, elections have consequences. The vote that you put forth in this election will determine the course of the country for the next 5 years and beyond. Use your vote wisely. Do not give it away like it is a cheap object. Remember, the incumbent government and these prospective candidates, they are looking for your vote. Make them earn it. The final piece of advice that I will give when it comes to voting in this general election, at least in this video, is that look for the candidate or decipher who is the candidate who you think will serve the nation's best interest. Not the interest of a certain few, but the interest of the wider population, especially the nation's health. Oh yeah, and one more thing. Don't go and vote a certain party or a certain candidate because your mom tell you to, or your father, or your brother, or your sister, or your auntie, your uncle, your nana, your friends and them. No, you do your own digging and you find it within yourself. You make peace with yourself after you have worked out who you think is the best party and the best candidate to represent. Yes, you may have your own interests, but just remember, the party and the candidate, they are looking after or supposed to be looking after the interests of the nation. Find that party, find that candidate who best represents the interests of the nation. In the next video of the series, I'll be looking at another questionable government decision, removing VAT on basic food items. If you've reached this far, I thank you for watching. Don't forget to like, share, and subscribe to support this channel and to spread the message of improving your health by improving the food environment. I thank you for watching again, and I'll see you soon.